Hello. Welcome everyone to Esri's 2020 User Conference and our discussion today focused on COVID-19 and GIS. My name is Este Geraghty and I'm the Chief Medical Officer at Esri. I'm joined today by an amazing group of panelists for what I expect to be a thoughtful, robust and certainly a timely conversation. We are so glad that you could join us. Now, before I introduce our panelists, I really just want to set the stage a little bit for our discussion. This, no doubt, has been a trying time for all of us across the globe. COVID-19 has impacted 188 countries, infected millions of people, and killed far too many. For each of us, the impacts may range from inconvenience to financial devastation, from illness to grief. Despite the bad, we're also seeing points of inspiration and innovation, and that's what I really want to focus on today. In particular, our panelists who come from the business sector, the government sector, and the health sector have all demonstrated leadership in this time of crisis, using GIS to better support the evolving needs of their organizations and the people they serve. So, let me have you meet them now. We have Andrew Schroeder, Vice President for Research and Analysis at Direct Relief, Zach Robinson, who is the GIS Analyst for the City of Santa Monica, California. And please meet Dora Barilla, Group Vice President for Community Health Investment at Providence St. Joseph Health. And Nikki Paripovich-Stifle, the GIS Manager at Kohler. And finally, we have Brian Smith, who is the Senior Vice President of GeoDecisions at Gannett, Fleming. Now, I would like to begin with a question that I'm going to pose to each of you to just get us going. When did you first realize that GIS was going to be useful within your organization for tracking and responding to COVID-19? Now, Andrew, I am going to start with you since I know that you're accustomed to being a first responder.
Thanks, Este. Yeah, I think it was right at the outset that we began using GIS for response. And by outset in this case, I mean in the end of January, we started getting reports back from contacts in Wuhan, China about the spread of a mysterious respiratory virus and began shipping PPE out to health centers and needed to track where all of that was going and start to compare information sources about how the disease was evolving. And I think GIS really integrated into all of that, all those parts of what we were doing.
Like I said, you're a first responder early on to the game. Nikki, it's the same question for you. When did you first realize GIS was going to be useful in Kohler?
Well, for us, it was fairly immediate as we're a global company, right, in the power generation business, in manufacturing faucets and fixtures on 6 continents. So first hearing about the disease in, I think back in December, right, we knew we had to start gathering our data and, understanding how that was going to impact our offices and our facilities globally and start monitoring that. We didn't think it was going to spread this far, but it was definitely an immediate for us.
Well, that's good to hear. Brian, same question for you.
Yes, so at Gannett Fleming, we're basically, engineering architecture GIS company, so location's always very important to us. From my perspective, I think at the beginning of the EPC is when I realized it was going to happen. I was in California at partner conference, and we started making plans at that point.
Yeah, that was kind of a turning point. That was the first weekend in March, I believe, and things were really heating up by then. So Dora, when did you first think about using GIS for tracking and responding to COVID-19?
The first, when we saw 2 dots on a map, Este was, immediately we had some of the first confirmed cases in our service area in Washington. So just instantly, my job is to really look at community health and knowing that those are going to be so interdependent in terms of hospital utilization and what's happening in the community. We instantly knew that we needed to start pulling in the data and tracking as soon as possible.
And Zach, what about for the city of Santa Monica? When did you guys first start thinking about it?
Well, we were monitoring the situation since late January, early February, but we didn't really get heavy with our GIS usage until California issued its Safer at Home order, which was, I believe, the second week of March. So at that time, our city's Emergency Operations Center was activated, and a lot of city staff were called into the Emergency Operations Center, and that's when the need for GIS really grew. We knew that we needed to show case counts within the Los Angeles area, our neighboring communities, hospital capacity in our city. So yeah, around the first few weeks of March.
I have to say that I'm pretty gratified in this question to hear that the idea of using location intelligence is coming up early in disaster response across different sectors, which I think just in itself is a change from what we've seen in the past. So I find that very interesting as a new trend. And we've actually seen a lot of changes happen as the pandemic continues to evolve and involve a lot of our efforts. And Zach, I was wondering if you could tell us how, particularly as a government entity in the city of Santa Monica, how have you been able to respond to the changing stages of the pandemic?
Yeah, there definitely have been a lot of changes in terms of how we've responded, how we've tracked the pandemic here in the city of Santa Monica and our surrounding communities. In the very beginning, when the Safer at Home order was issued, there was a lot of confusion by our residents, by our business owners, questions like what businesses were open, if parks were still open, if schools were still open. A lot of these questions that folks had really had their root in GIS because it's where things are and the status of those facilities. So the city instituted a public hotline where residents and business owners could call the city with their questions. And a lot of the answers were provided based on the different dashboards and maps that we created to show what was open, what was closed, and things of that nature. So in the very beginning, we created a survey for our business owners to fill out to indicate whether their business was still open or if they had closed. A lot of businesses were forced to close based on the public health orders, but a lot of our essential businesses obviously were still allowed to operate, and we wanted to try our best to promote those local businesses to our residents to say, you know, these businesses are still open and you can visit them for your essential needs. So we use Survey 123 to allow our business owners to say whether they were still open, what services they were providing, if they had special hours for vulnerable populations like our senior community. And then those results were automatically populated on a web map for our residents to explore, interact with, and it became a very popular resource for our residents and our business owners who were so appreciative that we were promoting businesses that were still open during this crisis. As the situation evolved, as new health orders were issued, we needed ways to enforce those health orders. There were some businesses that were operating who were not supposed to be operating. So we enabled our code enforcement division to track interactions with businesses and even with members of the public in public places to track when we were issuing code enforcement violations or just code enforcement education practices like handing out flyers about physical distancing and things like that. That tracking proved to be very effective in showing where enforcement was happening around the city. And finally, as we're now in our third month of the response, we're really trying to track how our local case counts compare to our neighboring cities, to the Los Angeles County as a whole. And the county's been great at providing those really detailed numbers. And we can take those numbers, we can map them, we can show them on dashboards, and provide a high-level picture to our executive team so that they can make more informed decisions about when we should be bringing staff back to the offices.
I think that's fantastic, and I'm sure that all of your efforts to be agile in this crisis have been so appreciated by the residents of your city. So thanks for that work. And Andrew, I have to say your organization in a way has a similar challenge in trying to respond to changing stages of the pandemic, but on a very different scale, right, on a global scale. So can you speak a little bit about how Direct Relief is experiencing COVID-19 as both a very local and a global phenomenon?
Thanks, Este. Yeah, I think it's a good way to frame it, that we've experienced it both as a local and a global phenomenon, and that's really played into how we use GIS as well to be able to think fluidly across scales. So Direct Relief is a global humanitarian organization. Like I mentioned, we began responding in China, where we don't normally work, actually. So part of the role there was for GIS is to begin understanding health systems research. How is the health system laid out? Where are the partners? How does the demography of China impact on what we were understanding about the epidemiology of the virus? And we learned from our experience in China as the virus has moved across many other parts of the world. As you mentioned, it's been in 188 countries. We've actually responded in over 40 of those now. And some of those also are countries which, again, similar to China, we don't normally respond to. I mean, we've responded in tandem with the NHS in the UK, which I never actually thought I would see the day that we would be sending humanitarian aid to the NHS. And similar, had to be able to understand rapidly changing epidemiological patterns, which all have a spatial background throughout Europe, the United States, Africa, Latin America, and put that into a coherent framework. Likewise, to link that with supply chain. So the key problem we were responding to in terms of our practical activity is the distribution of PPE, personal protective equipment for making sure that healthcare workers stay safe in their jobs. We had to understand where supply shortages were happening, why those are happening, and how to be able to connect available supply with the people that were in need of it most. Also to link that into risk analysis to be able to stay ahead of the curve of where you're likely to see cases transform into hospitalizations and deaths. And the risk profile was known in some respects early on in China, but has changed significantly as our knowledge has changed, as the virus has moved around the world and as it's affected countries which have a very different type of population, where now in Africa we're seeing people that are much younger but are immunocompromised in new ways, that have HIV, and that are living in much more austere conditions than where we've seen, say, older populations in northern Italy or New York that were really severely adversely affected. And that, I think, has been the key for us to link all of that spatial data into a framework which communicates to our decision makers, our program team, to the partners that we're working with throughout the world, and then to our donor public, where Direct Relief is entirely privately financed, and we have to make sure that we're telling our donor public about how their contributions make a difference to being able to affect the course of the virus.
A lot of work, big challenges, big tasks, and Andrew, you mentioned supply chain, and I'm guessing, Nikki, that's also an issue for you at Kohler. You're also a global company. And what kinds of global challenges has your organization had to deal with?
Well, I would agree that this is definitely both a local challenge as well as a global challenge. with global supply chains and local associates in production, right? We want to be able to monitor each level, and again, be able to understand its impacts, to our process, to our customers, and being able to track that and to be able to track the spread and track the incidents that a lot of the folks on this call are related to folks on this call, right, have been publishing globally, to be able to have that, to be able to respond to our customer needs or our associate needs by alerting, by tracking orders and, alerting the appropriate customers to timeline changes or, to support the business continuity of our company. So that was very critical, both from a health and safety awareness standpoint, and that's ongoing, right? And then the ongoing business processes of the supply chain and tracking and tracing that, as well as then, looking at, how the impact of our partners, right? And the impact of the economy, and how do we support our partners globally in assuring that they have the items that they need in their stores, in their showrooms, in their communities to assist them. That's been amazing, and not related to GIS, but mentioning the NHS, Andrew, that was a great way that Kohler was able to actually support and change some of our manufacturing operations to make some PPE with face shields. So that was pretty amazing for our UK business of Myra to be able to shift and support NHS in that way as well.
Well, I think you're demonstrating in real time what intricately interconnected world we have and how we all can work together and support each other. And maybe we can do that in broader ways as we go forward. Maybe we'll address that later on in the conversation. But Brian, I wanted to ask you, I think that Gannett Fleming is really thinking about location in a very, I would say, forward-leaning way. And so I really wanted to ask you, what does the new normal look like for your organization and its work, and what role does GIS play in that?
Sure. The new normal is a discussion that we have almost every day. Gannett Fleming, very similar to Kohler Company, is an older company. When I say older, we're 105 years old, privately held engineering firm. And as part of that, you have different generations of folks that have that work within the organization. So what's become our new normal is a very virtual working environment. We've deployed ArcGIS Online in a lot of different locations, not one, but using ArcGIS Online, we've deployed different mapping capabilities that enable our employees to look at project activity, where employees are, number of COVID cases. We've also deployed our notification system from a corporate security perspective to distribute information out to people as they, as our CEO wants to push that information out. But what new normal looks like with us is we are looking very hard at how we structure our organization around things like ArcGIS Online, Autodesk 360, Office 365, cloud computing capabilities, moving a lot of our code bases out to virtual environments in AWS or Amazon, essentially trying to distribute as much as we can so that our employees can stay up and running. We haven't had the opportunity to travel very much, so meetings like Zoom meetings or team meetings are very important. One of the things I've noticed a good bit is that as we move forward, particularly with these types of meetings, video has been a lot more relevant to us to be able to have that kind of still interaction between each other. So, and then lastly, I'll say that I think that what this has taught us is just how important location analytics is, and not only how important it is to us, but then how we can use what we do internally at Gannett Fleming and GeoDecisions to help serve our customers moving forward and kind of catapult away from the idea of GIS being used for COVID only into now we can do all these other really cool things with indoors, with capacity, with contact trace. Well, I shouldn't say it like that, but using location analytics to understand migration patterns of humans, for example, those types of things. So that's very important to us, and moving forward that way, we'll continue to serve our customers.
I love that notion, and it's something that I think those of us who think spatially think about all the time, is that events come up, but these patterns are repeatable, and we can use them in other ways throughout our business to add value. So I love that you brought that up. And I know that the pandemic is changing the ways that we're thinking about a lot of things. And so, Dora, I know that you have been a longtime believer in the value that GIS can bring to healthcare organizations. And I'm wondering if the pandemic has shifted the way that your organization views GIS. I mean, are more people starting to see what you've always known as GIS in healthcare?
Yeah, thank you, Este. I think absolutely, it just being trained in public health and working in healthcare my entire career, I've always known how, spatial analytics are so important in terms of community. I mean, just the foundations of public health are really in our communities. And as this we had been really looking at adoption of, we've always thought about community and it's core to our mission. But as as COVID came in, and especially into our communities, some of our communities first, and you're thinking about providing healthcare and not knowing, really understanding what's happening in community, understanding who your vulnerable populations are, because we had to plan for a lot of different scenarios. If people got sick, how were we thinking about being prepared? Who are we going to partner with? What were alternative sites? And especially with looking at those that are vulnerable communities. And so I think it really connected the dots between, people know it inherently, Este, that community's connected to health. But this, you get so busy, and you're working inside a hospital or inside the four walls. Those connections aren't always so visible. And what COVID did was really just put those hand in hand. As soon as we caught our breath in terms of making sure we had enough PPE and our healthcare providers were protected, and our patients were cared for, then it really went into community. And how do we look at mitigation? Because we didn't know how this was going to spread, and who were our partners in areas where we had vulnerable populations. And so it was an absolute, I think, magnifier to how important spatial analytics and how important community, not only the information that's happening inside the hospital, but within the entire community. And as we move forward, becoming even more important as, that we have different waves of this, or that the secondary impacts in terms of food insecurity, housing, or just the economic downturn, and how that's going to impact, perhaps homelessness in the future.
Yeah, it seems worth saying again, we're also interconnected. And so thinking about all these things, and I loved what you said, and I've said it since you mentioned it to me a few weeks ago, how disasters magnify disparities. And so we really have to keep an eye on the vulnerabilities in our populations, and they may differ with the crisis at hand, but always being mindful of that is so important, and I know all of you are doing that. And part of the way I think that we do that is through analysis and modeling. And Andrew, I know that you're a big time analyst and modeler. What role did modeling and analysis play in your response and your efforts?
We could go on and on about this, but just the short answer is that I think spatial modeling helps us to think through relationships in a new way across a number of different factors. So, for instance, we began using mobility of human population data in a very extensive way, looking at impact of social distancing orders and just how populations are changing. That has to be related to risk factors to understand, what are the underlying dynamics of the communities that are seeing changes in population over time. So income, age, other kinds of comorbidities, and whether that impacts on the probability that you would see higher or lower distancing rates impacting viral spread in communities that are more or less vulnerable, and then linking that into location around the networks that exist for how we distribute material and how we support health systems. And to me, like, modeling is a somewhat intimidating word for folks that just literally means that all of these things are related to one another, and we need really effective ways to link them together and express those relationships, because it's only through the relationships that you actually see what it is that you're going to have to act upon and bear in mind as you try to improve the response. And that integration of that relational dimension to our work, I think, has been core to all of the things that we work on in GIS now. And so I think hopefully more people begin to kind of take that into the central pieces of their GIS.
And I love that you're trying to make modeling sound less intimidating, because it can be really, just like you said, about the relationships, and maybe not as scary as people think. So Dora, is it scary for you at Providence St. Joseph, or have you guys done some good modeling and analysis as well?
Well, I mean, modeling has been key, and I'll just echo what Andrew said, the relationships of communities and, how interconnected we are. There were so many, we knew so little at first. We had to do so many what if scenarios so that we were prepared, because we're, that safety net for our communities to make sure that we were providing the right services and connecting with our communities, or if not, partnering with others so we could. So, just that interconnected piece with our public health departments and other health systems, Este, that, what were we modeling to prepare for worst case scenario? What would we do? And beginning to think about the relational pieces of where our vulnerable communities were, and really understanding what the vulnerabilities were and having that data. So I think that the what if scenarios modeling and really beginning to think about the interconnectedness of communities is really key. And even beyond that, even now, as we think about what we're calling, whether it's the wave 2, wave 3 of people that have had restricted care because of some of the close downs of, our health systems, or those that are still afraid to go out and haven't necessarily had the resources. There's really going to be a new normal in terms of how we're thinking about providing care and where we need to do that. Obviously, we've had an extreme, significantly high adoption of telehealth. But as we think about opening up and people needing care, that's going to be critical that we're thinking about modeling and analysis into the future.
Well, it may not have as much to do with GIS, but yay, telehealth is finally becoming. I'm just going to have to say it. I know that everybody, I don't think anybody would disagree when we say that data is critical and foundational, in fact, as a resource for any of the GIS applications that we want to put together. And so I'm going to ask everybody to respond to this question, just so that others kind of have a sense of what were the data sets that you found most valuable for your organization's work to inform your response. And Zach, I wanted to start with you on this one.
Sure. A lot of our data that was really critical, especially in the beginning, was around our city staff. And it was around knowing who was on site, who was teleworking, who was in the field. And these numbers changed daily. And we wanted to ideally bring the number of on-site staff down over time. And we were able to do that by tracking our staff, asking them to fill out a survey each day when they were reporting to work, whether they were teleworking, whether they were on site, whether they were in the field. Another really critical data set that we've used throughout the pandemic is data from our local hospitals. We have a few hospitals in the city of Santa Monica, and thanks to some data sharing partnerships with them, we're able to report on their daily numbers, the number of patients that are going into those hospitals, the number of patients that are being ventilated, and just the number of positive COVID cases reported at each hospital. So of our 4 area and local hospitals, we're able to show trends, and that's been really critical and really helpful for our emergency operations center to track those changes over time.
Awesome. So Nikki, how about for you? What are the most valuable data sets?
Well, it was so great to have, Johns Hopkins obviously capturing a lot of that data. It became really a, visibility to the world for the world. And so many folks were able to leverage the data from their center. And so that obviously was critical. The dashboards were critical to bring that initial awareness. And I think Andrew mentioned some of the social distancing data, right? And the human, understanding human movement and to help, in some of those predictions and monitoring, obviously the emergency status, right? Or the restrictions by state was very important as well. But again, so we had to find global, we had to find maybe even some regional, we had to find county, if we had sub-county, right? There was some serious hunting along ArcGIS Online lines and with our partners to, start capturing that data. But, and it hasn't stopped, right? We revisit the GIS Hub, weekly, if not daily, right? To see what else is out there. I see some, the UN posted some great work. So we want to be able to leverage that. So it's just, continually staying in contact with, with the great providers that are out there.
Thank you. And thanks for mentioning the GIS Hub. And for anybody who hasn't taken a look at the resources that are available there, and lots of great data resources, it's at coronavirus-resources.esri.com. So be sure to take a look. And you're right, we're updating it often. So Brian, what are your favorite data sets that are adding value?
So as usual, Nikki stole all my thunder, But no, seriously, I think from our perspective, it started with kind of our project data and our employee location data. That was very important to where we started. The Johns Hopkins data was very helpful. We also, with some software that we have internally, we also were able to create a lot of data sets that we needed to view by combining different data sources into information that we wanted to share. We also use Hub internally to show a lot of different information to our employees. And then lastly, I'll just throw a plug in there for Living Atlas because, even me, I'll go out there and play with Living Atlas because I just like to see what's out there. So it's pretty cool stuff.
That's awesome. I like it too. Dora, as a fellow healthcare person, I can almost guess what data sets you'd like for that.
You mean data is important, Este, in this, and just to the point of, what we're seeing with the backlash of public health and, just some of the having that data is so key. So the obvious, the cases and the hospitalizations and, just beyond that, though, I think looking at the social vulnerability index was really important for us to, begin to think about that. But then also, I think everyone mentioned, we call them our caregivers or our employees because we needed to really begin to do an analysis of who we could deploy that might have had clinical skills. In case we had, a surge, that we were really understanding our own assets and how we could deploy those in different ways. So that was really some of our most critical data sets. And I think Zach mentioned, we're one of your hospitals there in Santa Monica, the sharing of data And, I can't emphasize how important that is, that we can have some data sharing agreements, begin to think about how relational this data is. And we were so excited to have had some of the, existing Esri platforms because it was easy to share. And another thing that we did in terms of our data sets was partnering with other hospitals, because we were all responding to some of the critical needs, related to COVID. And so we instantly did a co-investment dashboard to see who was investing where and identifying where there might be some gaps and where we could collaborate and partner together. So I think it's really the ability to not only use that critical data, but then to be able to share with our partners.
That's amazing. And Andrew, you mentioned before the social distancing data, the human movement data, as a reflection of adherence to social distancing, which is one of my favorite data sets. But how valuable was that, and what other data sets did you rely on?
I think that COVID-19, from a data point of view, will be remembered actually as the threshold moment for when we began using large-scale population movement data for public health emergencies. We've known that this exists for a long time, but this was the event that has made it so that we can look at meaningful metrics that emerge out of it. So looking at the likelihood of populations to stay at home or be out in public, the pressure on certain points of interest as recommendations have been issued on the policy front around beaches, parks, other public spaces, and those have been tied into non-pharmaceutical interventions with a specific role in mitigating the virus. It's just not that it's not happened before, so I think it was incredibly valuable. I think the other I agree with everything folks have said so far. The one thing I would add is the role that the volunteer data community has played in being able to help quickly step in, fill those gaps, and make data available that we've been able to put to work in our GIS and our analysis. There was a group, early on, in order to help understand the mobility data, we needed to understand much more granular spatial information about where the policies were actually changing. How have recommendations been issued in different communities throughout the country at the state, county level? They were actually quite complicated, and they continue to be through the reopening phase, very complicated. That data at the county level was, to my mind, filled in best by a group at the University of Washington that was literally graduate students that began doing their own research, putting their data into GitHub, and then linking it into spatial analytic tools like ArcGIS that let us compare the policy space with the space of human mobility. And there's countless examples like this where people came together, recognized the need to fill a data gap, make it shared throughout the community, and put it to work so that we can actually begin making some advances in control of COVID-19.
Andrew, you made me think of something, and I think it applies to what each and every one of you said about data that I recognize as kind of another new trend, and that is the data sets that you all found most valuable and useful were in some way, some part of them were real-time data sets. They were things that were changing daily, if not more often than that, and you relied on that. And when I think about the work that we've done in health over the years, never before have I seen such a reliance on real-time data to help us make better decisions. So it's kind of interesting that you all brought that up, whether you're talking about where your employees are, or where vulnerable populations or cases are, or how people are moving across the planet. It's kind of a fascinating thing that you all just said. So I'm
Esty, can I say one last? Esty,
yeah,
can
of course,
I say
Brian.
one last thing? So one of the things that we're starting to investigate is the use of infrastructure that already exists and how you create data structures from that infrastructure. Take, for example, traffic cameras or sidewalk cameras, and understanding migration patterns at a community level, not only just for disease spread, but also then for future design and how you design sidewalks, how you design walkways, how you design bridges, et cetera, to kind of encourage these ideas. So as we kind of grew at Gannett, and as we talked to our customers, we talked an awful lot to our customers about the idea of encouraging social distancing, the idea of not being able to necessarily enforce it, but now using data sources, both real time and historical, to encourage design in a different way. So I just wanted to throw that out to everybody in case they were thinking along those lines.
Well, I'm really glad you did, because I think this whole idea of design is incredibly relevant, especially as we think forward, because, you know, you answered the question before, Brian, about the new normal, and none of us knows exactly what it's going to be, but we know it's going to be different, and design, intentional design, is going to be a part of that. So I think that was great thought. And I have one more question for everybody. It's probably a bigger question than you can do briefly, but I'll ask you to do your best here. I'm just wondering, has your experience in managing COVID-19 with GIS influenced how you will approach other kinds of disruptions, emergencies, events in the future? And thinking about that, and again, I'm adding too much to this question, but I'm going to do it anyway. How can we as a global community do better in the way that we work together to respond to these kinds of things? I think you've all touched on that, but I'd like to give you each a few seconds to respond in what you think everybody should take away from this idea. Who should I call on? I'm going to call on Brian, because you spurred me on.
Like, because I spoke last, so I get to speak first. So, to answer your question, if it hasn't made you rethink the future, then I think you need to get on that boat very quickly. That's essentially what we're trying to do, is rethink the future. And I don't know if it was during this or previously when we were talking, but you know, as location scientists, as we all are, we see COVID as almost a business case, if you will. The ideas, the methodologies, the analytics, you know, the statistics are very similar with that business case versus another business case. So kind of understanding it and then taking it and morphing it into a new business case, I think is going to be absolutely critical for the future.
And Nikki, what's your take on all of this?
Well, no question. And I think the theme, you know, in my thinking is really connectedness, because as Brian mentioned, the new design, right? That's maybe external design, but there's also organizational design, and, you know, the way that, you know, we can more seamlessly communicate by understanding relationships, right? Of across silos of our business, you know, that maybe where people didn't talk so much, you know, with 35,000 people globally, right? Can't talk to everybody. But, you know, how do you forge those new relationships and discover a new way of working? I think is one thing. And then from a data standpoint, really, and how we can grow our connectedness among data and data sharing and that standardization, because, you know, I can say that we were very hungry for data globally, and, you know, the number of providers that would do that and do that consistently, you know, I think that's a major change that we can make for the future and do better.
I couldn't agree more. Fingers crossed everybody heard that. Dora, how about you?
Absolutely. I mean, if you're not thinking about the next disaster and, you know, the whole disaster response, I think you're right. You're really missing the boat here. So thinking, you know, really building on what we've already put in place, what's been rooted. And I think, you know, something that we can all think about in terms of this interconnectedness is, you know, thinking about how do we build on the data that we have for the sharing and the interconnection as we move forward with, we can't say probably in the next year, but, you know, that next disaster is coming, or that next response. And so, you know, not to build on everything that we've learned in terms of spatial analytics and how important all this is, I think, it would be a real shame. And to, really identify where our assets are in our communities and to be real clear on that so that those can really emerge and we can really see what's happening based on some of the stories. I think a lot what was, as you guys say, what was invisible has become very visible. And how do we make sure that that's not erased?
Definitely my hope. Maybe this is the year 2020 for a reason, and we'll all have that clarity of vision moving forward. What do you think about all of this, Zach, and how COVID-19 and GIS is going to influence your approach to disruptions of the future?
Yeah, well, interestingly, a lot of our COVID work with mapping and dashboards, it's kind of been influenced by past disaster responses here in the city of Santa Monica. Just last year, we helped the city of Malibu respond to a very large fire, the Woolsey fire. And a lot of those same field monitoring techniques and dashboards really helped us guide what we would create in response to the COVID pandemic. And in terms of thinking ahead, despite the tragedy of the pandemic, what has been very encouraging is that our response to COVID-19 and our use of GIS and Esri tools has really promoted the value of location intelligence in our organization in ways that it just hadn't before. The amount of visibility of GIS products here in the city has just skyrocketed because it's been such a valuable tool, and that's been so encouraging. And finally, thinking ahead, I think our work with field monitoring, surveying what is going on in the field, whether it's businesses or especially thinking about fires or earthquakes, those damage assessments. We've already been thinking about ways that we can use Esri tools to be ready to respond to those types of disasters in the future.
That's great. Again, I think your citizens, your residents are going to be very happy about that. Andrew, I gave you the first word. I'm going to give you the last word too. So what do you have to say?
Thanks. I think, sort of echoing what other folks have said, I think the main impact on us has been to change the scale of how we understand what I would call data readiness. It kind of goes back to your point about real-time data, Este, where the data sources that are required in order to do that and do it well are large, and they change quickly, and that's been something that we've had to become newly adept at in terms of being able to have data availability and managed appropriately. It also links into what a kind of dimension of readiness that I would think of as methodological. So it only becomes valuable data if you have methods that can be applied quickly to make sense of it. And so methodological readiness has to be kind of part of our toolkit in the humanitarian community going forward. And likewise, the ability to connect that or translate it into either our own decisions or, I spent quite a lot of time advising policymakers in this response. And I think that the ability to have a translational readiness that fits into the policy space and the decision space that is kind of guiding how we respond to this kind of crisis is important. And so all of those three dimensions of readiness, I think, are sort of newly elevated in our thinking about what future response looks like.
Well said, and well said by everyone. Actually, this is such a great conversation, and I hate for it to end. I feel like we could continue to learn from each other for hours. But I do want to sincerely thank all of our panelists for their time today, and especially actually for all of your efforts in fighting COVID-19. Thanks so much to all of you, and to our viewing audience, thank you very much for joining us.